This module is an introduction to GS1 and the standards used in the healthcare industry. Our purpose as a neutral, not-for-profit membership organisation is to facilitate discussions with industry about problems they have that GS1 standards can solve. We harness the power of standards to transform the way people work and live. We're not a government organisation, and the GS1 standards have and continue to be created with industry agreement. GS1 standards are used to identify every person, every product, and every place within the healthcare system. It all started back in 1973 when the first barcode was approved in the US for retail. The first barcode was then scanned in 1974 on a 10-pack of Wrigley's Juicy Fruit. We've grown a lot since 1973. The first GS1 organisation, then called the Uniform Code Council, was created in the United States, followed a couple of years later by a group of European countries coming together, and we've grown to 116 local member organisations, providing support to industry and our members to adopt the GS1 standards across many different industries and to over 2 million companies worldwide. It's estimated that over 10 billion GS1 barcodes are scanned daily on over 100 million products. Everything we do is built on the foundations of identify, capture, and share. We start with unique identification, and here are some of the GS1 identification keys. Of these, the global trade item number, the GTIN, is the most common. This is used to identify products, and it's a number you see beneath barcodes in retail stores. This GTIN is sometimes referred to as an EAN or a UPC. These are the old terms for the GTIN 13 and GTIN 12. When the GS1 brand was formed worldwide, the generic term GTIN was introduced for all the different length GTINs. You can hear more about these in another module. We also have the global location number, which is most used to identify organisations such as manufacturers, retailers, and healthcare providers. Hospitals use these to identify physical locations. They're also used to identify the trading partners in purchase-to-pay systems and for ship-to and bill-to locations. We also have the global service relation number. This is most widely used to identify patients and staff in hospitals. Then we have the global individual asset identifier. This is used to identify individual assets such as medical equipment and surgical instruments. These identifiers are then captured in a data carrier. The most common is a linear barcode such as an EAN13 or a UPCA. Of the barcodes, the most common is the EAN13 to capture the GTIN 13. This is used across retail globally. The UPCA barcode is used to capture the GTIN 12 that is issued by GS1 US to its members. All other GS1 member organisations issue GTIN 13s. We're now seeing an increase in the use of GS1 data matrix, which is a 2D barcode, particularly for medical devices and pharmaceuticals and for patient wristbands. The reason being it can capture a lot more information, not just the GTIN that identifies a product or the GSRN that identifies the patient and caregiver, but also capture production information and demographic information in a very small space. Alongside barcodes, we also have RFID tags. The main difference is that these do not need line of sight for them to be scanned. They do need a reader which can be placed in various locations across a hospital, for instance, and pick up the RFID tag placed on medical equipment. We are seeing more hospitals introduce RFID for asset tracking, so staff know where their assets are, and a lot less time is spent by nurses looking for medical equipment. Then the data is shared by scanning the barcodes. In advance of the scanning, GS1 standards are used within Global Data Synchronization Network for the sharing of product master data in a standard format. The standards are used across EDI systems to identify the trading partners and products being ordered electronically, and used for sharing event data in a real time using EPCIS. The adoption of GS1 standards has been driven by several programs and legislation. In 2014, the Department of Health and Social Care published the NHS Procurement Strategy, which mandated the use of GS1 GTINs and GLN standards for suppliers to the NHS. It also talked about using GS1 standards for applications within hospitals to improve procurement processes that lead to improved patient safety. A couple of years later, the Scan for Safety programme began, with 6 trusts across England became demonstrator sites and were funded to implement GS1 standards and to report back on their findings and produce guidance for other NHS trusts to help them implement those same standards for those same applications. This has since expanded out to many more hospitals. NHS Supply Chain has launched a programme to support the implementation of inventory management systems across 20 trusts that will utilise GS1 standards for product identification. The other UK nations have recently launched their own Scan for Safety programmes, including Scotland implementing a nationwide inventory management system and Wales rolling out a nationwide procurement and replenishment system using the scanning of product barcodes. Northern Ireland is introducing GS1 standards via its nationwide Encompass programme and has started using GS1 standards for asset tracking. In the US, the FDA introduced legislation for the unique device identification of medical devices. The GS1 system is by far the most prevalent of the barcoding standards that are used for medical device identification. This was followed by the EU medical device regulations, and GS1 standards work in the same way, which is the benefit of using standards. You don't have to change out what you're already doing for different markets. The Medicines and Medical Devices Act in the UK provides a platform for medical device regulation to be implemented in the UK. More on that to follow from the MHRA. I'm now going to introduce identification for regulated healthcare products. The Falsified Medicines Directive was introduced for prescription-only medicines to combat falsified medicines making it to the patient. They talk about the unique identifier and a product code. The product code is the GTIN. The capturing of production information such as expiry date and serial number is done using the GS1 application identifiers, which you can learn more about in other modules. Here's an excerpt from the EU MDR, and it's like the FDA's UDI regulations. Both require DIs and PIs to identify products. In later modules, we'll be discussing how you allocate global trade item numbers, GTINs, to your products and how to encode the dynamic production information, such as dates and lot, within your GS1 barcodes. This shows how the GS1 foundations of identify, capture, and share fit with the UDI requirements. The UDI is a GTIN to identify the product plus the production information. AIDC is a barcode to capture the GTIN and production information. And the GTINs are shared via UDI databases, such as the Good ID in the US and UDIMED in Europe. The MHRA has its own medical devices registry, and you can already enter your GTINs into this system. Thanks to GS1 Ireland for producing this graphic. Here we see an image of a theatre, and we can see where the GS1 identification keys are used. We have the GLN for the location of where the procedure is taking place, and the GTINs that identify the syringe as a medical device. We have a GSRN, which is identifying the patient and the caregiver. And we also have the GIAI, a Global Individual Asset Identifier, which is identifying individual assets such as a gas cylinder and a surgical instrument. This point of care scanning provides for more accurate traceability to improve the product recall process and feeds into medical device outcomes registries to make for better care. GS1 standards are used to identify every person, every product, and every place within the healthcare system.